Hi, my name is Mark Rossi from Monash University. Today I'm going to discuss a research project we're completing on spinal cord injury and peer support to facilitate community integration following injury. The aim of our research is to explore and better understand the lived experience and perceptions of peer support services for people living with traumatic spinal cord injury. In this presentation, I'll provide some background information about what spinal cord injury is, its impacts on community participation and current peer support interventions, identify the research gaps, describe the research aims and methodology, ethical considerations, the research plan, and the implications of the research. Victorians living with spinal cord injury often experience poor health outcomes, decreased social, community and economic participation, social exclusion, and report lower quality of life than the general population. Often inaccessible built environments exclude people that use mobility devices from participating in the community. People with spinal cord injuries nearly always require the use of a wheelchair to mobilize. Decreased community participation and greater time spent doing individual activities results in social isolation and fewer social and meaningful relationships. Over 15,000 Australians currently live with SCI, and more than 350 people sustain SCI annually. That's more than one new injury per day. The most common causes of SCI in Australia include road accidents, falls, occupational and sports injuries, and violence. Non-traumatic causes often result from underlying pathology, including infectious disease, tumour, musculoskeletal disease, and congenital problems. 4 out of 5 new cases of persistent SCI in Australia occur in males, with 46% of new cases caused by transport crashes and falls accounting for a further 32%. Traumatic SCI has a significant burden on many Australians and society. Spinal cord injury is caused by traumatic or non-traumatic damage to the spinal cord, resulting in motor, sensory, and autonomic impairment. The degree of impairment and incapacity correlates with the injury lesion, with higher level injuries resulting in greater upper limb impairment. Historically, people that survive SCI had significantly shorter life expectancies than the wider population, resulting from medical complications including urinary tract infections, circulatory, and respiratory problems. Medical and technological advancements in recent years has led to increased survival rates and life expectancies. Yet, social exclusion and lower community participation continue to result in poorer health outcomes and lower reported quality of life for people living with SCI. Restoring functional ability and maximizing independence and community participation are priorities for rehabilitation services and governments alike, and are necessary for this population. 64% of traumatic SCI in 2013 and 14 had a neurological injury in the cervical region C1 to 8, commonly known as quadriplegia or tetraplegia. Sustaining SCI often changes and diminishes participation in meaningful roles and activities outside the home. Despite increased survival and independence in recent years, recent data indicates the economic cost of tetraplegia at $1.3 billion and $160 million for paraplegia, with lifetime costs exceeding $9.5 million and $5 million respectively. Therefore, there are both person-centered and economic incentives to prioritize interventions and services that facilitate and enable community participation for people living with spinal cord injury. Peer support and mentoring has increased independence and participation while providing psychosocial support in health and rehabilitation settings. Peer mentoring typically involves relationships between individuals with similar lived experience, which positions them well to provide emotional, informational, esteem, and tangible support to the mentee. Both large and small-scale studies demonstrate and support the use of peer mentoring with the SCI population, including psychosocial adjustment and empowerment benefits for newly injured SCI patients, improved health, increased autonomous outdoor activity and work and education participation for people living with spinal cord injury, increased life satisfaction and occupational participation in long-term people with SCI support the use of peer mentoring following SCI and show the greatest benefit within 12 months of sustaining the injury. Despite evidence supporting the use of peer support for people with SCI, research shows that peer support was reported as the lowest rehabilitation priority and the highest unmet need of people with SCI in Canada. These findings are concerning and are reflected in Victorian community participation SCI research that indicated the need for existing peer support to be strengthened and take a more central role during the transition home. Topics typically addressed in peer support programs include issues specific to SCI, including coping strategies, work, transport, physical conditions, and sexuality, without providing mentors with effective mentoring skills or behaviours. The SPIRE 2015 peer mentoring training program in Melbourne supports this research and teaches peer mentors basic communication techniques and discusses challenging behaviours, mental health issues, and cultural diversities. Peer mentor training programs could be strengthened and improved by informing them with theoretical and evidence-based practices while tailoring peer supports to individual needs and characteristics. Two theories that have demonstrated benefit in peer support for the SCI population are transitional leadership theory and self-determination theory. Despite research providing theoretical frameworks to inform evidence-based peer mentoring and the key issues experienced by this population, research gaps remain and additional knowledge is needed to understand and inform effective peer mentoring programs. To better understand the lived experience and perceptions of peer support services for people with SCI following injury, research questions include: 1. What community integration challenges, issues, and barriers do people with SCI experience following discharge? 2. How do people with SCI describe their experiences of challenges, barriers, and resolution of issues? And 3. What experiences and outcomes do people with SCI describe related to peer support services? A qualitative phenomenology research methodology will be used because the purpose of the research project is to explore and develop an intimate understanding of the lived experience of people living with SCI. Using a phenomenological research is appropriate because we are interested in the lived experience of peer support services for people with SCI. Through holistic meaning, research conducted in natural settings using emergent methodology, a small purposive sample to collect rich qualitative data and inductive analysis. By exploring the perceptions and experiences of peer support services, the strengths, weaknesses, risks and benefits of peer support following SCI can be identified and used to inform and strengthen an evidence-based peer support intervention for newly injured patients. Because the purpose of peer support services is to improve the psychosocial well-being of people with SCI, the lived experience and direct awareness need to be understood, since all knowing depends on individual perceptions. Therefore, the project will be viewed through a constructivist interpretive paradigm taking a more naturalistic, relativist stance recognizing multiple meanings and subjective realities. The interpretive paradigm is apt because our aim is to understand the experience and perceptions of peer support services following SCI. A critical realist position we'll be taking as we are seeking to capture the way in which peer support is experienced and its essential structures. Because a qualitative research methodology is being used, participants will be engaged using stratified purposive sampling. Purposive sampling involves the deliberate selection of participants who are best positioned to provide the information for understanding the meaning of health-related events. A sample of 15 carefully selected participants with variation in age, gender, life stage, work status, and life roles will be used to capture various experiences to increase transferability of findings. Due to the exploratory nature of this research project, data saturation is not a major consideration. Key informants from peer support services at the Victorian Spinal Cord Service have access to many people with SCI and are well positioned to identify suitable participants that offer a range of characteristics and life experiences. To generate understanding of peer support concepts of interest, semi-structured interviews will be used to elicit and measure participants' experiences and perspectives. Semi-structured interviews provide rich, in-depth, qualitative data, allowing for verbal and non-verbal data to be collected while being flexible enough to explore tangents. Ensuring research rigor in qualitative research is vexed as it involves exploring subjectivity, reflexivity, and the social interaction of interviewing. While research reliability and validity measure repeatability and credibility in quantitative research, credibility, transferability, and trustworthiness are concepts of rigor used in qualitative research. These concepts are measured differently because quantitative and qualitative research serve different purposes, albeit to generate understanding and for the purpose of understanding respectively. Interviews will be recorded using audio recording on a mobile phone, allowing for accurate and comprehensive data collection for future use. Written notes will be also taken by the interviewer. Following data collection, participants' responses will be coded and grouped together using an inductive, iterative process into themes and categories. The use of semi-structured interviews allows rich descriptive data to be collected and analyzed using content analysis. Once themes have emerged, exploration of the relationships between and among themes will occur through identification of patterns and interconnections. Coding analysis is both qualitative and quantitative because it involves the recognition and coding of meaning and the counting of these meaningful chunks. Ethics involves moral principles and rules of behavior that govern professional services and research. While ethical guidelines for conduct vary by professional code, discipline area, and institution, they usually ensure that participants have given informed consent, that no harm or suffering is experienced by them, and ensuring participants' confidentiality and privacy. To ensure any actual or potential risks of harm are minimized, the National Health and Medical Research Council Ethical Conduct on Human Research Guidelines will be adhered to, including research merit and integrity, justice, benevolence, respect, and consent. Because people with SCI have a long-term chronic disability, additional ethical considerations are necessary under NHMRC guidelines because people with spinal cord injury are often in dependent or unequal relationships, which may compromise the voluntary nature of participants' decisions. Research shows that people with SCI are not only a highly researched population, but that some individuals may choose to participate in research not because they have weighed up the risks and potential benefit, but because the desperation of their circumstance leads them to disregard anything other than the possibility of benefit, which places a higher ethical obligation on researchers. Additional special ethical considerations include 1. Offering respondents the opportunity to participate in person or by telephone, Skype, or Zoom, which gives participants opportunity to minimize the impact of dependency. 2. Arranging suitable accessible interview location or at the respondent's home. 3. Ensuring respondents feel valued and respected through the use of appropriate language and research methodology. 4. Respondents can be supported in an interview by a family, friend, or carer. And 5. SCI-specific issues and conditions, for example, ensuring appropriate climate, hydration, and pressure care. Ethics approval will be sought from the Monash University Human Research Ethics Committee because our research involves interviews with human participants and is therefore subject to ethical clearance. To apply for ethical approval, a HREC review application form will be completed. The SCI Peer Mentoring Research Project is expected to be completed over a 12-month period between July 2018 and July 2019. The first 6 months will involve conducting background research, designing the research project, and contacting key stakeholders and partners, including other researchers, to ensure time is managed effectively and potential risks are mitigated. Peer mentors from AQA will be contacted early in the project to maximize the chance of identifying suitable participants that are representative of the SCI population, which will increase the transferability of findings. The second 6-month period will involve data collection through interviewing participants, followed by coding and transcription of these concepts, themes, and ideas. The content of data will then be analysed to recognise meaning through the use of language, specifically through the use of words, sentences, and paragraphs. Once meaning and understanding of participants' perceptions and experience is established, findings can be made and the research report will be written. The project budget is $2,300. This includes 15 $30 Coles vouchers to adequately compensate participants for their time and possible travel expenses, as well as the cost of transcription at $2.50 per minute of data. Resources that are required to complete the project include a suitable location to conduct the interviews, either a participant's home or another quiet, accessible location, an audio recording device to record the interviews. This could be a mobile phone or a portable audio recorder, consent forms, 15 times Coles vouchers for participants, and a computer with word processing software. This research is timely with the introduction of the National Disability Insurance Scheme, which intends to increase access to supports and services for people living with disability, thereby reducing inequality and improving health outcomes for this population. While increasing access to services may improve health and participation for people living with SCI, strengthening existing peer support services and systematically utilising these during the transition home following injury is both needed and recommended in SCI research. Our research builds upon peer support literature by addressing gaps in the literature that need to be answered to create an effective, evidence-based peer support intervention.